नमस्कार, मैं हूं आशीष गुप्ता, founder of Samarth Eldercare, and today I have with me Dr Hemi Soneja.
Hello everyone.
As we know, today is World Diabetes Day. This year's theme by WHO is Breaking Barriers, Bridging Gaps, which emphasizes equitable access of diabetes treatment and care for underserved communities. So today we are going to spend some time with Dr Soneja, getting some ideas, some inputs about how to do it better. Just so you know, Dr. Soneja is a diabetologist who has been practicing for the last 2 decades in UK, USA and India. She is a senior consultant endocrinologist and obesity medicine specialist at Max Hospitals, Gurgaon, and is also the director of Dr. Hemi's Diabetes, Obesity and Thyroid Clinic. First of all, I think the thing which comes to mind is about prevention. Are there ways of thinking about prevention? Are there certain things which work better to prevent the disease or complications that may arise from the disease?
So I think when we talk about diabetes, one of the most important things to understand that it is a disease of complications. So we want to work on prevention at every level. Firstly, yes, we want to prevent development of diabetes. And as a part of that, we want to focus on healthy diet, exercise and the good lifestyle modifications for each and every individual, irrespective of the age, their gender or their weight for that matter. A few things which everybody with diabetes needs to take care of is their blood pressure should be under control, their cholesterol levels need to be in check. They need to be getting a once a year complete eye examination done, including a retina check, which is done by an eye specialist and not just by an optician. So with diabetic eye disease also, we do not have symptoms beforehand, but can be very well picked up on a once a year eye exam, and we can prevent issues with sudden blindness in the long term. Next comes a dental examination, which a lot of times people ignore. Yes, brushing twice a day is important, but getting a dental exam and the required cleaning done once or twice a year is a must. It is also related to heart disease to a certain extent for elderly people, and this is not a very well known fact. And going further, we want to look at preventing other illnesses irrespective of the diabetes status. With or without diabetes, there are immunizations which are recommended, which can help prevent quite a few of these severe infections in a great number of people, like pneumonia or a herpes vaccine.
Let me sort of talk about it from a different perspective. One is prevention, but let's say, I'm a person who has diabetes. Are there things or ideas you have for me on how I can still live healthy?
So I think in addition to what we just talked about, we want to keep in mind that every individual is going to be different. Mm-hmm. If something has worked for my brother, it does not necessarily mean it's going to work for me. So, and other thing also is that our body changes over time. So whatever diet, exercise, medications were working okay for me, say 5 years ago, might not necessarily be the same 5 years later at this point of time. As we grow older, as we lose some of the weight with the aging process, we need to go down on the medications. So do make sure you're checking your sugars at a recommended interval in between, and seeing your doctor on a regular basis.
I think the idea that every person is different,
yes,
and therefore may require a different treatment is a very important one, and I would like our seniors to take that away. So thanks very much. We really appreciate your time, and I'm sure our seniors will benefit a lot from this discussion with you. Thank you.
I hope so too. Thank you so much for having me. Thank you. Namaskar.